Dear colleagues, today I am going to present you the result of our longitudinal work of the big team of the Family Medicine Department. We worked very hard to make it happen, and today I am glad to present you the results of our work. Our project is called OSCE FISH. Why OSCE? OSCE is the Western system of objective structurized clinical examination of patients in the doctor's practice. You can meet the standardized patient who is not a real patient but has all features of real disease, and you have to work with him. You have to examine him, you have to ask proper questions, you have to make proper diagnosis, you have to show the skills of communication, and finally you have to make a clinical decision and make a proper management plan. You see, it's a pretty complicated plan, but to make it easier for you, we prepared all these tasks in the scheme of fishing. What do we do when we go fishing? We need a fishing rod. In our meaning, fishing rod is meeting the patient. Then we need a fishing line, which is greeting the patient. And then we need a hook, which is golden minute. So, please try to understand the system of OSCE FISH, and it will definitely help you in your future practical and clinical work. First, we meet the patient. When you are going to meet the patient, you have to make some special steps. You have to smile a little, then you have to stand up. Standing up has double meaning in our practice. First, it's our respect for the patient. Second, it's our physical activity during the routine work. If you meet 25 patients, you need to stand up at least 50 times when you greet the patient, meet the patient, and when you lead him after the consultation to the door. Shake hands. We understand that in some places and in some cultures, shaking hands, especially men and women, is not very welcomed, but it is a very good close contact which can increase compliance of the doctor and patient. You have to lead the patient to the chair and show him the place where he can sit. Now, an important step to make a compliance with the patient. Greet your patient. Greeting, in our symbolic meaning, is a fishing rod. Means to say hello to the patient, introduce yourself as a doctor, and ask the patient's name, and use it at least twice or 3 times during the conversation. Everybody likes to hear their name, and it will make a compliance better. Hello, I'm Dr. Kolesnik. How can I call you?
You can call me George.
Okay, how old are you, George?
I'm 25 years old.
Now you understand that you will never catch a fish without a hook. This is a symbolic meaning of a very important moment in your conversation with the patient. In the Western literature, it is called golden minute. Why golden? Because it's very important. Why minute? I will tell you. While golden minute, you usually ask an open question. For example, how can I help you today? And you let the patient talk out for a minute whatever he thinks about the reasons of his diagnosis, reason of his disease, and you listen patiently without interruption. Why minute? It is evidence-based that during 60 seconds, 80% of the information which patient wanted to tell you can be told. You can take it into consideration or not, but you will understand what is the main complaint of the patient, what does he think about the reasons of the disease, and what did he take during this time of disease. What happened to you?
Uh, I have a so I have a sore throat. It started yesterday. After I had some beers. And then I also had some ice cream with my girlfriend. And then it's been bothering me, really bothering me.
So you use the golden hook or a golden minute and you are ready to catch a fish. I memorize time when I was a student like you, and I couldn't realize how can I remember all information about history taking, physical examination. How can I make a proper diagnosis of all number of different diagnoses? How can I make it in a proper way? What to do after? How not to forget all communication skills? We were scared of the exams with the patients. This fish will definitely remind you the strict algorithm how to make a proper history take a history, which is the head of the fish, to make a proper physical exam, which is the body of the fish, and to take a tail, which is the proper diagnosis or preliminary diagnosis. Look, the fish have several fins, and these fins are very important. As for upper fins, they are very important questions, four questions which you usually ask yourself after performing the history taking. The other upper fins, which are also four questions to yourself, you have to ask after the physical exam. And we have also three more fins on the lower part of the fish. These are fins for communication during history taking, during physical exam, and during making the preliminary diagnosis and also presenting this diagnosis to the patient, discussion about his future plans, and so on. So let's investigate our OSCE fish. Fish's head is the history taking. What is obvious on the head of the fish? This is the main complaint. It is the eye of our fish. Usually you know the main complaint out of the golden minute. You can also ask what else is bothering our patient. Identify the important additional complaints. Then focus on the main complaint. How to take a history of the main complaint in the proper way? Let's see. You know that the common complaint in our practice is pain. How to remember the algorithm of pain questioning. Probably you know Socrates, the famous Greek philosopher, and probably you remember what he said. I know that I know nothing. Hopefully you will know something about pain questioning. But remember Socrates and use his name as a mnemonic scheme or acronyms. S. Site. Where is the pain located? O. Onset. When did it start? C. Characteristic of pain. How does the patient feel pain? Is it dull or acute or stubborn? Radiation of pain. Associated symptoms. Timing. E. Exacerbation and elevating symptoms. And a very important part is severity of pain. You usually have to ask patient the severity of pain according to visual analog scale. It is well-known scheme of pain questioning. If it's minimum pain, then it's 1. If it's maximum pain, which you can imagine, it's 10. Why it's so important? Because if the patient says that this pain is chronic for a long time, it will definitely change your management plan according to the severity of pain or how much the patient feels this pain. This scheme can be used also while asking the other complaints. Maybe not the strict scheme, but some of this acronymous scheme you can use. For example, if the patient has a running nose, definitely you will not ask about site, but you will ask about onset, characteristic of discharge of the nose, then radiation is not here, but association symptoms may be appropriate, timing, exacerbation and elevation, and also severity of the symptom. Use Socrates scheme and you will never be lost in the algorithm of questioning of pain.
So you have a sore throat.
Yes, yes.
Okay. So when did it start?
Approximately yesterday.
Okay. So one day, yes?
Yes.
How can you characterize the pain?
It's sort of like an achy pain. Some achy pain, I can say that.
I see. Does it radiate somewhere?
It feels like my whole neck is painful.
I see the whole neck is
Yeah.
painful. Is it associated with something? Do you have fever?
Well, last night I felt a bit hot, but I wasn't able to measure my temperature, so. But I could say maybe I'm feverish.
So you've been feverish for the whole day, were you?
Yes.
Okay, I see. So does anything worsen your symptoms?
When I try to swallow, it's very painful, very, very painful. I couldn't sleep the whole of last night
Oh, I understand.
because of this pain.
So I see it was so severe that you couldn't sleep. So I'm sorry, it was really hard. Is there anything which makes it better?
Yes. So I took some strepsils yesterday, so
I
the
see.
pain sort of calmed down, if I may say.
Okay, and according to the scale from 1 to 10, when 10 is maximum, so how much is your pain?
Maybe I'll say a 7. A 7 out of 10.
Okay, I see.
Now we are ready for the next step, which is medical history. Usually we ask or clarify when did the symptom start, how did it start, what symptoms were in the beginning, how did it progress. I remind you, in family medicine we usually focus on the patient complaint and we usually ask medical history concerning the main patient problem. Ask about the other diseases, injuries or other problems only in the context of the main complaint. In our case, we didn't ask patient about medical history because it was clear before. Then the next step, which is drug history. This is a mandatory step to ask about medications which patient accepted before, dosage, duration of treatment, and effectiveness of the treatment. Please don't forget to ask about allergies for the drugs, maybe antibiotics or other food allergies in this directory. Again, focus on the patient's problem. Take a drug history only in the context of the main complaint.
Did you take any drugs except strepsils?
Yes, I took some paracetamol, just one tablet.
Okay.
Let's go forward. The next step is the social history. It's also a very important step. We suggest you to remember social history using the mnemonic scheme which is called SODA-F. Smoking, occupation, drugs, alcohol, and family history. I remind you that you have to use the social history and ask about these items only in the context of the main complaint. But we have some universal risk factors like smoking, drugs, alcohol, which are feasible to ask in every case and can be sticked to any disease.
Do you smoke, George?
Yes, I do.
Okay, and what about alcohol?
I occasionally drink with my friends.
Do you use drugs?
No.
What about allergies?
No, I don't have any allergies.
Okay, what is your occupation?
I'm a student.
And did anybody of your family members have the same symptoms?
Yeah, my girlfriend had some symptoms related to this. She was also complaining of the same thing.
Mm-hmm. Okay, thank you.
And the final step on the head of the fish, which we call review of systems. System review is asking about different systems or organs and symptoms on them, focusing on the patient's problem, and accomplished systems and organs can be asked considering this main complaint. For example, if the patient has sore throat, I will definitely ask about his other ENT organs, maybe about his teeth, and maybe about his heart problems. If the patient has chest pain, I will definitely ask about system of lungs and heart and maybe digestive system and maybe other systems. So every symptom, every main complaint requires different system review.
George, do you have cough?
No, I don't have a cough.
Okay, do you have problems with your teeth?
Yes, I do have problems with my teeth.
Okay, do you have runny nose?
No, I don't have a runny nose.
What about fever?
Yesterday I felt hot, but I didn't get the chance to measure my temperature.
So, as far as understood, you have sore throat, which is very severe, such severe that you can't swallow. Yes, and it happened yesterday, from yesterday, and now you have, probably you have a fever. Yes, and you came to me for examination.
Yes, that's true.
Okay, thank you.
So, it seems that we are done with history taking, but we have two very important moments before finishing the history taking part, or the head of the fish. First, look at the lower fins. Lower fins usually symbolize our communication skills. Here, while history taking, we use two types of communication skills. nonverbal and verbal communication. What about verbal communication? Nonverbal communication. Nonverbal communication means, first, eye-to-eye contact, avoidance of barriers between you and patient. Also, nodding your head. Verbal communication has three different types, which are open questions, reflection, and summary. As soon as you are done with communication skills, we are coming to a very important part of the history taking, which are four fins, upper fins on the head of the fish. We usually ask ourselves in the end, and we ask you guys to ask yourselves 4 questions in the end of each history taking. First, which organ or system is affected? What are 5 possible diagnoses for differential diagnosis? Why 5? Why not 25? It could be even 105, but we usually choose the most appropriate diagnosis for this case. If we don't have them, we can use another 5, and then another 5, and we can come to the conclusion finally. The third question is, which risk factors are connected with the main syndrome? Always try to evaluate risk factors in any case. This is mandatory according to evidence. And the last question, what is special? What is so specific in this case? Usually we have to clarify the specificity of the case, and sometimes it is a clue for your proper diagnosis. So let's think about first question. Let's answer the first question. Which organ or system is affected? In our case, we think that it may be pharynx or tonsils. The second question, what are 5 possible diagnoses for differentiation? We may think about acute tonsillitis, pharyngitis, pharyngeal foreign body, cancer, or peritonsillar abscesses. The third question, which risk factors are connected with the main syndrome? Remember, we have universal risk factors. Smoking and alcohol, they are present here. Definitely, they can be somehow somehow connected with the symptom or main complaint. And the last question, what is so special in this case? What makes it different? It is the young age of our patient. It is the rapid development of the disease. We found that there was cavities and patient's girlfriend has similar symptoms, which is important for me as a family doctor. Now, it seems that we are done with the most complicated part of the fish's head, and we can come to the second part, which is the fish body or physical exam. You see, the physical exam of fish body consists of several vertebrae. I will talk about them later. But don't forget that you have to do something very important before starting your physical examination. Inform your patient about the examination. Prepare yourself. Wash your hands in front of the patient. Get patient prepared. For example, if you are ready to perform some intimate procedures, for example, breast exam, let the woman cover her breast, one breast, and let her other breast be open for your examination. Let the patient take off their shirt or t-shirt or whatever before you start examining them. Prepare curtains to make some privacy for the patient. Then inform the patient about the examination.
George, could you please sit here?
So, are you ready to explore the fish skeleton? Let's see how I make physical examine in my practice. First, vital signs. It is mandatory to start with this step, but it will be very helpful if your nurse is trained enough to do it before you and present vital signs for you. After that, we usually start inspection.
Now I'll examine your throat. Okay?
Okay.
Open your mouth. Sorry. Your throat is inflamed. There is pus in your tonsils.
After that, we start palpation. Don't forget that you have to let patient know what you are going to do.
So now I will examine your neck.
Okay.
Okay? Is it painful?
Yes, a little
Sorry,
bit.
sorry. Your lymphatic nodes are swollen.
The next step is percussion. In our case, it was not necessary to make percussion. By the way, in some cases, the meaning of percussion has very historical, traditional way. But in some cases, it's pretty helpful. Next step is auscultation. In our case, I made auscultation because I was aware of if the heart of my patient is affected.
So may I just auscultate your heart?
Okay.
Everything is fine.
Okay.
May I check your lungs, please?
Okay.
Please pull up your shirt. Breathe deeply. Everything is fine.
Okay.
Okay?
Usually, in the end of physical exam, we can make specific investigations. As a family doctor, I do a lot of specific investigations in my practice. I can make many different lab tests by myself. Streptococcus test, H. pylori fecal antigen test, blood test for hepatitis, HIV, HCV, and other different tests.
To make your diagnosis properly, I need to take a swab from your throat. Okay? It will give me a rapid result if there are bacteria in your throat.
Okay. Is this painful?
No, it will cause a little discomfort.
Okay.
Okay? I will take a stick and take a swab from the throat.
Okay.
Please open your mouth. Sorry.
we are in the end of physical exam. Probably you have noticed that I used several communication skills even during physical exam. First, I used non-verbal communication skills. I tried to understand the patient needs to keep his privacy. I tried to make painful manipulation just once. I showed respect to the patient. Verbal communication. I explained what I am going to do before each procedure. I explained what did I found during each procedure. I informed patient when it is painful maneuver. I showed my empathy and I explained my findings in the end of the physical exam. After examining the fish body or human body, we are ready to come to our 4 questions. Do you remember upper fins of the fish? We ask ourselves 4 questions which we did in the end of history taking. We ask which organ or system can be affected. Maybe we can change our decision. What are 5 possible diagnoses? We can clarify this question using pros and cons model. I will tell about it later. Which risk factors are connected with the main syndrome? Maybe we could find something else. And what is specific in this case if we found something else in the end of physical exam? So, organ system. In our case, it was the same organ system, throat. As for 5 differential diagnoses, I want to show you a small journey considering this or that diagnosis and my way of pros and cons clinical decision making. Let's start. I may think about foreign body of pharynx because patient had pain in his throat which appeared suddenly. As for cons, I will probably not think about it because patient didn't report about eating fish or other products containing bones. It is unlikely to be associated with the sudden initial fever which our patient has. So, definitely it's not foreign body of pharynx. Maybe it is viral tonsillitis or pharyngitis. Yes, I can think about it. Because the patient has a sore throat and fever. But unlikely it is it because he doesn't have runny nose, no cough. Maybe it's cancer of pharynx or larynx because patient is a smoker and this condition can happen in smokers. But unlikely I will think about this diagnosis as a proper diagnosis in this case because our patient is young. His smoking status is short. Pharyngeal cancer is not typical for this young age with this short duration of smoking. Maybe in 20, 30, 40 years we may think about it again. Usually cancer in the early stage is painless. And the same complaints has his girlfriend who doesn't smoke. Unlikely it's cancer of pharynx. We may think about peritonsillar abscess because it's again sore throat, difficulty of swallowing, fever, swollen lymphatic nodes, and strep test antigen positive. So it may be peritonsillar abscess. But I don't think about it now because patient doesn't have enough time for abscess development. Only 1 day passed. So, no severe intoxication is present, no trismus, which is typical, no specific pussy, fruity odor from his throat, no immunosuppression that could be a basic case for this condition. So I will not think about peritonsillar abscesses. And finally, I come to the decision that it may be acute bacterial tonsillitis because I found diagnostic criteria. When you prove the diagnosis, you have to clarify diagnostic criteria in any case. Basic diagnostic criteria for bacterial tonsillitis are called Center's criteria. For kids, they are called McIsaac's criteria. Today we have another scheme which is called fever pain scale. Anyway, all criteria are similar. Fever, it is present, so 1 score plus. No cough, 1 vote pro bacterial tonsillitis. Enlarged and painful lymphatic nodes, another vote for bacterial tonsillitis. Inflammation and pulsy discharge on his tonsils, which I found while examining, 1 vote pro. And then positive streptococcus antigen rapid test gave me the basics to prove that it is definitely acute bacterial tonsillitis. I also added my findings that the patient's girlfriend had the same symptoms, and also I took into consideration that the patient smoked and it may cause lowering immunity of his throat. Also, he has cavities, which could be a place for Streptococcus pyogenes chronic predisposition. And finally, my probable diagnosis is acute bacterial tonsillitis. I am ready to present it to my patient. So we see the fish is in our hands and we are ready to report the preliminary diagnosis to the patient. We are coming to the fish tail diagnosis. You have to present the diagnosis to the patient always when you are absolutely sure that it is so, or if you are not sure, or if it's confusing diagnosis, better not to inform the patient about it. Just say that you are going to make some more investigations to prove it. Before you present the diagnosis, invite the patient to sit down. Remember, sometimes we have a very pessimistic diagnosis, and this is the skill which is called presenting bad news. You will know it later. Report the preliminary diagnosis in the specific way, discuss the reasons, and explain prognosis. Patient needs to know the reality. Always involve patients in discussing the plan for future examination, treatment, and especially modification of his lifestyle. It is mandatory. Evaluate reaction of the patient and try to reassure him. After presenting diagnosis, we usually make a plan of further investigations. In our case, it was not necessary, but sometimes you need to discuss it with the patient. Then you make a treatment plan and inform the patient about your treatment plan. Again, you need to discuss it with the patient. Does he agree with you? Does he have any hesitations? Attention! Please avoid unnecessary investigations because it will lead to overdiagnosis and overtreatment. It's a new modern strategy which is called quaternary prevention.
So George, unfortunately you have a severe bacterial infection of throat which is called streptococcal tonsillitis.
Okay.
Because of that, I need to prescribe you 10-day treatment with antibiotics, amoxicillin.
Then we have an important issue which I want you to do while every consultation of your patient. In the end of every investigation, lifestyle modification. It has a strong evidence that we have to ask about risk factors every patient, and we have to promote lifestyle modification in every case. Find things which can be improved in the patient's lifestyle.
So the problem is that you have a caries of your teeth, and also you are a smoker. Did you ever think about quitting smoking?
I'm a bit on the edge, 50-50.
But you have to think about it because it can reduce your immunity of your throat, local immunity of your throat, and with presence of infection, it can cause such condition in future. Okay. That's why I really suggest you to think about quitting smoking and visiting the dentist. Okay.
Okay. So I'll think about it and then I'll see.
The previous steps were done if you are totally sure with your diagnosis. But it is not so in the real life. Sometimes you hesitate. You are not sure if you made the proper diagnosis. For differential diagnosis, we give you a very nice and understandable mnemonic scheme, acronyms, to realize what group of diseases could it be. The system is called vitamin B, C, E. V is vascular. No, it's not vascular. I is maybe infection. In our case, yes, it is infection. T, maybe it's trauma. A, maybe it's autoimmune disease. M, maybe it's metabolic disease. I, maybe it's idiopathic or iatrogenic, caused by our intervention. N, maybe it's neoplasm, maybe cancer. C, maybe it's congenital. D, degenerative or dystrophic. And E, maybe it's endocrine. In any case, this scheme will help you to classify in what group of diagnosis is your patient's disease and to clarify the disease. It seems that we are done with the fishtail. Now we have the last lower fins left. Do you remember? Our lower fins are communication skills. We propose you the scheme of ICE: ideas, concerns, and expectations, to discuss whatever diagnosis, treatment plan, or other proposals from the doctor.
Is everything clear to you, George?
Well, you did talk about my diagnosis, but I have a question about the use of antibiotics.
Okay, why?
Well, it's concerning me, and I think maybe it might be harmful. Is it possible to avoid antibiotics entirely?
Why?
I'm concerned. I read about it on the internet. They might lead to liver damage, so I'm worried about this issue. And
Okay, so you are worried about the damage of your liver.
yes.
Okay, so don't worry. The prescription of this antibiotic is absolutely safe because antibiotic is very often we prescribe it even for newborns or babies. That's why I strongly recommend you to take this to avoid complications of the disease, of the bacterial disease, which can harm even your heart or other organs. So better to take, and in 10 days you will be healthy and you can get rid of this infection. Okay?
Okay.
Now, it seems that we may finish our consultation.
So let's meet in 2 days. I'm waiting for you during your treatment, okay? And come back again and I will examine your throat again.
Okay. All right.
Okay? So thank you. Bye bye.
Thank you.
So, hope you will enjoy the new methodology of OSCE fish. I wish you good luck in mastering OSCEs during our cycle. And please use your new skills in your future practical life. Good luck and thank you for your attention.